Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, Ascension is now under investigation and scrutiny on a number of fronts. Ascension is, of course, one of the United States' leading nonprofit and Catholic health systems. They have over 134,000 associates, 35,000 affiliated providers, and 139 hospitals under its management in 18 states. In the Birmingham, Alabama area, this includes St. Vincent's and associated hospitals such as St. Vincent's East. Wisconsin Senator Tammy Baldwin earlier in 2023 accused Ascension, which is registered as a nonprofit tax organization in the U.S., of operating like a private equity fund and aggressively pursuing investment opportunities while staffing and services were allowed to slide into decline in its hospitals. And this was addressed to Ascension CEO Joseph Impicciche in a written letter. The catalyst for these concerns were articles published by the Milwaukee Journal-Sentinel and Milwaukee Magazine alleging Ascension recently experienced disruptions to patient care, long wait time, surgery delays, and staff concerns about safety. One of these hospitals was Ascension Columbia St. Mary's in Milwaukee. Senator Baldwin also wrote that the St. Louis-based Ascension has for-profit investment activities dwarfing what it provides in annual charity care as a non-profit tax-exempt organization. She mentioned the closure of Ascension's Providence Hospital in Washington, D.C. in 2018. Ascension allegedly charged the hospital for services provided by its subsidiaries and companies within its private equity portfolio amounting to $27.5 million in fiscal year 2017, while Providence Hospital posted a loss of $32.8 million US dollars. Meanwhile, at this year's JP Morgan Healthcare Conference, Ascension CFO Elizabeth Foshage highlighted Ascension's $18 billion worth of cash and investments. As you can see in my videos where I record phone calls dealing with representatives of Ascension in the Birmingham area after my own experience as a patient, is that there is apparently rampant corruption within this healthcare provider. I think one thing that's apparent is Ascension may suffer from being too big to fail. It looks like there is not adequate enforcement or resources by governing bodies and authorities at the various levels such as city, county, state, and federal to properly check and balance Ascension's activities. And what's been allowed to occur here is the corruption has been allowed to grow out of control. I think it's disgusting that Ascension brags about investments and profits on the order of tens of billions of dollars after my own experience. Because what I know is that underpinning the fortunes of these medical doctors and not-for-profit businessmen, a mountain of wrongful dead patients. And as big as these issues are that Senator Baldwin highlights, if you take a look at what happened to me, there are far greater issues of importance that relate to corruption, fraud, and medical negligence when it comes to Ascension and their associated doctors and facilities. I went to Ascension as a patient in 2018. I was misdiagnosed. I had an x-ray scan. I got my records later. I found out that while the radiological doctors told me, and the emergency department doctors told me I had no injuries present. It didn't sit right with me. I got the records. I got the original x-ray images. I put the x-ray images and the records in these videos so you can see the truth and the contradiction. I left the emergency department at Ascension St. Vincent's East in Birmingham, Alabama, believing I had no injuries present. 8 months later, infection grew in this wound, as well as 3-inch long parasite insects. Almost died from this injury. I almost didn't make it. All right. I believe that there are many patients like myself who are not so fortunate to discover the truth of their injuries and challenge Ascension on the facts. I survived, and I'm not happy about what happened to me. So one activity that I've pursued in the midst of my recovery is documenting firsthand corruption as experienced by a patient trying to go to these millionaire doctors and have my injury acknowledged and the errors corrected. And you can see in my videos, I don't have such good luck in doing that. I called Ascension CEO Joseph Impicciche in 2021, never got a call back from the CEO. And I'll play that call once again at the end of this video. You can hear some details about what happened to me. One issue that I had firsthand dealings with that I will mention here as it relates to the subject of non-profits operating with profits in mind. This would be my visit as a patient with the Christ Health Center in Birmingham, Alabama. Now, Christ Health was spun off from St. Vincent several years ago. And what happened to me, you can see a couple hours worth of video on my dealings with this in depth on my YouTube channel. But one experience that I had here was I was charged $109 to see a MD, all right, a medical doctor. This was Terry Daniel Smith. And then a short time later, I went to another Christ Health clinic in Birmingham. I saw a nurse, NP, nurse practitioner, Anna Musgraves. I was charged $107 for that visit. I had to pay out of pocket to see a lot of nurses and doctors around the time of those visits in 2019. So I got some firsthand market analysis. At other clinics and medical practices around Birmingham, Alabama, I was only charged around $50 to see a nurse practitioner. So Christ Health also registered as a nonprofit, and they operate Ascension's residency in this area. Ascension hospitals also refer patients to the emergency department to Christ Health, so they have a partnership. Why was I charged double the going rate around town to see a nurse practitioner and almost the same amount to see a medical doctor? I discussed this issue in a recorded telephone call with Christ Health Chief Executive Officer Dr. Robert Record, MD, earlier in 2023. Yeah, and again, if you go to university to become a medical doctor in the state of Alabama, you're looking at 4 years in college, at least a $30,000 tuition. To become a nurse practitioner, you're talking about 2.5 years at a community college and around $13,000. So there's a big difference between nurses and doctors, okay? So why is this nonprofit apparently charging people double the going rate in town? And this didn't sit right with me. The answers that you get from the medical practice administration, they rattle off a bunch of gobbledygook about government protection and certification to justify the price gouging.
Thank you for calling Ascension. At this time, our administrative office is closed and our associates are working from home to limit the spread of the coronavirus. To leave a message in the general delivery mailbox, please press 2. Thank you. You've reached the Ascension System Office general mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph Impicciche, and he can contact me at that number. And I have a message that I would like to give to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an X-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the X-ray, CT, MRI imagery and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network LLC and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Impicciche, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.